Hi, everybody. My name is Alexis Young. I've never filmed a video before, so I'm hoping that this audio is okay and that everyone can hear me. Today I'm going to talk about borderline personality disorder as the subject because I didn't know very much about it. I thought it was characterized by maybe, I guess, something similar to schizophrenia. And yeah, I was surprised to learn that it's not like that at all. It is a serious mental illness, but it is a personality disorder. And it's actually quite common. Apparently, about 1 in 100 people has BPD, borderline personality disorder. And it's often misdiagnosed. It's characterized by an inability to regulate emotions. So people without this mental illness can regulate. They can kind of go through life, and they've got their normal ups and downs. But people with borderline personality disorder have very intense feelings that they can't regulate. They've got an unstable self-image, so they have a hard time defining who they are. They have a hard time visualizing the type of person that they are. They have intense and unstable relationships with people, friends, family, colleagues. They have extreme likes and dislikes, so they can go from one end of the extreme to the other. And when caring for a person that's suffering from BPD, it must be pretty difficult. And it must be very difficult for the patient, of course. They tend to favor certain healthcare providers, people in the healthcare team, and that might make treatment quite difficult. They have an extreme fear of abandonment. It might be an imagined fear of abandonment, but nonetheless they have that, and it's quite extreme. They can feel very empty. They can have impulsive and risky behavior. So they might drive recklessly. They might, be going on huge spending sprees and things like that. They can present with symptoms of anxiety and depression, and extreme emotions, and that's probably why it's misdiagnosed. There's nine quite strong characteristics of BPD, and obviously depression and anxiety are one of them. But I guess because if you're not having delusions, they're not hearing voices, they don't have specific symptoms, I think it's probably pretty hard to diagnose. They can present just very distressed, as you can imagine. When it comes to the treatment of BPD, cognitive behavioral therapy is one form, and dialectal behavioral therapy is kind of a branch of cognitive behavioral therapy that includes acceptance and change strategies. So this is a talk therapy. Another form of therapy is medication. So in regards to medication, it looks like there's the traditional antipsychotics, such as risperidone and sorry, I have a really hard time pronouncing this one, aripiprazole, and atypical antipsychotics such as quetiapine. Now, if I could hear someone say that word, it would be very helpful. And I'm sure we'll hear it as the months and the years and the subjects go by. SSRIs, such as escitalopram, so that is an antidepressant. So that's going to be used, can be used congruently. Mood stabilizers, such as lithium, and benzodiazepines such as lorazepam. So that would treat, I guess, acutely the anxiety and the specific intense feelings that they were having in admission when they were admitted or in emergency. I think caring for people that have, I guess, acute symptoms of BPD, I think it would be quite difficult, especially if they weren't having positive feeling toward you as a carer. As well, I think that having their family on board, their loved ones, I think would be very, very helpful, because when they're in that state of mind, I think it would be kind of hard to understand what they're going through. You can, I guess, put yourself in their shoes to a certain extent, but I guess the acceptance of what they're dealing with themselves would be very, very helpful. If they feel as though you're not on their side as well, or if you're not there to take care of them, they might feel that fear of abandonment. They might feel like you're not doing enough for them. I think that would be very difficult. If I was faced with BPD, I guess I would just have to do my best to treat myself and to gain a therapeutic relationship with a psychiatrist and, I guess, a healthcare team, people that could help me and people that could help me help myself. And I would just do as much research as I could into different treatment options and dialectal behavioral therapy and medications. All right. Well, thanks, everybody. I hope that you could hear me. All right. Bye.